a cardiologist, I may allow small or moderate amount of alcohol to the public, but I will not allow a single cigarette. So we are really very strict about it that smoking should not be allowed because it is the main cause of heart disease. And you won't believe that I am getting a child. I call it him a child because I see patients of MI of around 40 to 50-year-olds normally. So I would get a patient of 21-year-old who would come to me with a MI just because of smoking. So that should be definitely banned. And this is a lifestyle habits I would encourage that should everybody should be keeping a heart healthy diet and a healthy weight and no smoking and no tobacco. So this is the cycle which is there that once there's a nicotine absorption is there, there's arousal, tolerance, and there's then craving, and then the vicious cycle keeps on continuing. So, and what are the signs of severe nicotine dependence? Like they're smoking more than one pack a day, and smoking within 5 minutes of waking up, smoking even while sick, waking up at night to smoke, smoking to ease symptoms of withdrawal. These are the kinds of patients in which we have to think of the nicotine replacement therapy. So, nicotine replacement therapy, we have gums, we have ibuprofen sustained release, we have nicotine nasal sprays, we have nicotine skin patches. E-cigarettes has been discussed a lot, and as a cardiologist, I am totally against e-cigarettes because the vapors which come out of the e-cigarettes, they are harmful. They cause heart disease. They cause cancers. They cause birth defects. The reproductive defects have been seen. So I would be against the e-cigarettes and other nicotine replacement therapy like patches or the transdermal patches and the chewing gums. They may be taken as help to take these people for quitting, because when you start them on these therapies, there are very high chances that they may be in the long run they may end up quitting the smoking. So this is the pattern of delivery of the various nicotine replacement therapies. Like nasal spray gives a brief shoot, and the transdermal patches, although they give a sustained release over a long term, but they are less harmful than any other forms of nicotine replacement therapy. So they may be taken as a less harmful substitute. So best time is to when you start quitting, and I hope the people they remain quit. So it's because it's not just thinking of quitting, it's important to remain quit. So the studies show that nicotine nasal spray has got the longest long-term effect of quitting in amongst all cessation medications. So there are mouth sprays, gums, lozenges, inhalators, which can help you take these patients for quitting for a longer period of time, and they should be prescribed by the doctor if we want these people to help quitting. And e-cigarettes I don't advise because they only 2% they do not relapse already, but the cancer causing chemicals and the heart disease causing chemicals, they are harmful, and that's why they have been banned by the US FDA. So the benefits are like that if the cigarette smoking is causing 7,000 giving 7,000 chemicals, the e-cigarettes would be giving very very less in comparison to that. But there are reports that they cause lot of heart disease, they cause a lot of addiction, they cause a lot of cancer, and that is why I am against the e-cigarettes, especially because as a heart disease, a cardiologist is more worried for that. It doubles the risk of heart attacks, and these are the research which shows that it doubles the risk of heart attacks. These are the dangers like the acetaldehyde, the benzene, cadmium, lead, nickel, nicotine. There are so many harmful things in the vapor. So it's not just a harmless cigarette, has got very harmful effects. And these are the chemicals, the long list of chemicals which come out of these vapors, and that's why the FDA has given warning and banned the e-cigarettes. and this was the cycle that they got banned in 2019. And can you get addicted to NRT? So what I feel that when you feel like you are over the cycle of this tolerance and craving, you should stop even the NRT. So it's not a substitute of smoking. You should not just continue with the NRT. You should ask your patient to stop the NRT when the addiction is over. And there are no side effects as such. For the nicotine gum, we advise them to park and chew, because if you just keep on taking one or the other gum again and again, then it would be a constant cycle of giving you nicotine release, and it will defeat the purpose of giving the NRT. So park and chew is the concept. So as such, they are not giving any side effects. Some problems like sleep problems, if they are having, there would be because of the nicotine withdrawal rather than the side effects of the nicotine patch or something. Nicotine patch gives you a very sustained release, so can be taken as a good alternative. And side effects are very less, and we can advise them they can take support of these NRTs to help our patients quit. So pregnant women and teens, they should not take NRT, and we should choose the right nicotine replacement therapy to our patients. Gums, lozenges, nasal sprays, and transdermal patches, they are very good alternatives. And they have to be given only once a day, the patches, so it's easy to use. The pattern of patients' use is also very good, and we should train them how to chew and park. So I would advise everybody to take help of the NRT, not the e-cigarettes, to quit the smoking and help in smoking cessation.